Welcome, everyone, to this episode of the Fired Up and Plugged In podcast powered by Emergency Reporting. This is the podcast for all 21st century fire and EMS personnel. I'm Tom Lewis, Enterprise Training Manager and the podcast producer. Joining our distinguished host, Randy Brugman, is Brad Rex. Brad is the President and CEO of EHome Counseling Group, a premier nationwide telebehavioral health company that provides metrics-based virtual mental health counseling services by video. EHome rigorously selects the best licensed, master's level counselors to ensure great outcomes and does online assessments to target care and measure progress. This client-centered approach has demonstrated effectiveness for both simple and complex conditions with very high customer retention and satisfaction rates. Brad is committed to improving the mental health and well-being of first responders everywhere. EHome provides an easy pathway for getting help when it is needed the most. Welcome to our podcast, Brad. Chief Brugman, it's all yours, sir.
Well, good day, everyone, and welcome back to another session of Fired Up and Plugged In. And today it's my pleasure to introduce Brad Rex, a Naval Academy graduate, Harvard Business School graduate, and former Disney executive, and is now the president and CEO of EHome, a premier nationwide behavioral health company. Welcome, Brad. Appreciate you being here.
Thank you so much, Randy. It's wonderful to be with you today.
Well, thank you. So you've had a pretty interesting career path from nuclear submarines to running a Disney Epcot theme park, and now you're into mental health care. So tell us a little bit about your background and how you became CEO of this company, EHome.
Great. Well, thank you, Randy. Well, yeah, it has been a very interesting time. I've had 20 different jobs in 12 different industries in over 30 years. So as you mentioned, I went to Naval Academy. I then did nuclear submarines. I actually was on a nuclear submarine during the Cold War, left there, went to business school, and then started my corporate career. And I'm currently located in Orlando, Florida. And what brought me down here was Disney. So I was with Disney for 12 and a half years. And the last 5.5 years of my Disney time, I actually ran Epcot theme park. I took over the day before 9/11. So it was quite an interesting time, as you might imagine, and learned a whole lot about terrorism and security and all kinds of things very quickly. But fortunately, Epcot, after 9/11 grew tremendously. We opened a lot of major new attractions, Mission Space, Soarin', Nemo and Friends. We expanded to the festivals. And so it was a really busy, fun, active time. And Epcot, of course, is my favorite theme park, but it's a fantastic park and just love everything there. I left Disney. I went to Hilton and ran their timeshare resorts. So I was their chief customer officer. They had 25 timeshare resorts across the country, and tough places like Hawaii, Las Vegas, New York City. Yeah, so somebody had to do it. So, and then, believe it or not, I went from Disney to death care, and actually ended up being the CEO of a funeral home and cemetery company, and brought the Disney experience to the funeral industry. So that was really my first opportunity to make a major change in an industry. And then about 5.5 years ago, a very close friend of mine came to me, and he said he had lost his wife to cancer. And as he was grieving her, he said, I want to help do something to help people. And he picked up an article about veteran suicides. Now, this partner is Rogers Curvin, and he was a pioneer in online college courses. And so back in the 1990s. So today we take that for granted, but back then that was like a crazy idea. And he said, if we could take counseling online, do it virtually, and take it to the veterans, then many more people could be served. It wouldn't make any difference where they were physically located. They could not have any concerns about stigma, confidentiality. And so he said, let's do virtual counseling. And of course, being a veteran, that really intrigued me. And so for the past 5 years, we've built EHome Counseling Group. We are a premier virtual mental health counseling company. and we're nationwide now. We're in network with the major insurance carriers, and a couple of interesting things. We actually are a major partner with Wounded Warrior Project. So we've treated thousands of veterans, and then just recently we became the primary provider for Team USA, our U.S. Olympic and Paralympic athletes. So
Excellent.
obviously that's in the news a lot right now, and we're just glad to be able to serve them with excellence.
Well, thank you, number one, for your service, but also for the services you're providing to our veterans. I know that there are many out there that have suffered, and this just gives them an opportunity to reach out and gain assistance. So thank you for doing that. And but you must have had some premonition of this pandemic.
No, actually not. Thankfully, but what we learned through the pandemic is the value of virtual care, telemedicine, telebehavioral health. Obviously, once COVID shut down all the hospitals, the doctors' offices, the counselors' offices, people still needed care, and so they did it virtually. And so, really, in a very short period of time, people found out how much more convenient it really was to do your care virtually, and so we've seen a huge change in that amount of time. But no, as terrible as the pandemic has been, at least from that regard, it has helped people a lot to get the care they really need and to do it much more easily.
So I would imagine through the period of the last 18 months, you've probably seen a pretty significant increase in people seeking service.
Absolutely. I mean, we've seen an over 200% increase in our business, and that's unfortunately because of the tremendous increase in mental health conditions caused by the pandemic, and also the fact that people have switched from traditional in-office counseling to virtual counseling.
Yeah. I've read several articles that we've probably experienced 10 to 15 years of change in a year, and
that's exactly right.
Yeah, it's probably unlikely that many of the people that are have a behavioral health issue or seeking counseling will probably go back to in-person visitation even after the pandemic is all over.
Yeah, that's exactly right, Randy. What actually Cigna did a fabulous analysis of this. They looked at 1 year post-COVID, the impact on telebehavioral health. And what they found, interestingly, was that for telemedicine, all right, the visits went up and then came back down. But for telebehavioral health, they went up and they've stayed at the same level. About 66% of all the visits now are virtual. And if you think about it, when you need a doctor, oftentimes they have to examine you physically. They've got to check your arm or look in your throat or whatever. When it comes to behavioral care, there's no need to actually physically touch the client. And so it's actually perfect for virtual care. And in fact, what we have found is that many of our clients say, I feel so much more comfortable doing it in my home. Yeah. And I open up a lot more, which makes the therapy much more valuable with the counselor. It's also, frankly, great for the counselors because they can do it from their home office or wherever they are, and they're not required to travel, and they can meet people on nights and weekends when they might not normally be able to do that. So we have a lot more night and weekend appointments. But I think the biggest thing is when you remove that geographic constraint where you have to go to a counselor who lives near you, you open it up to so many more counselors with so many more specialties that you're able to get matched much more closely with a counselor who fits your needs. And so, for example, when we take care of warriors, we're oftentimes able to match them with counselors who are military veterans, military spouses. They've worked on, bases, and so they're much more familiar with the experiences, for example, that a veteran might have gone through.
Yeah, and I think it takes away, I've heard this from firefighters, is that There were some reluctance actually going to an office and being seen by somebody else, and so I would imagine that our military people are much the same way, and so this kind of reduces that element or takes it away.
Absolutely, absolutely. You don't have to worry about who's in the waiting room being seen. The other big thing is you don't have to miss work. You don't have to travel. You don't have to find a parking spot. I mean, as I say, it's so much more convenient for people, and that allows a lot more people to get the care that they need, which is what's important to us.
Yeah. Well, I know being a chief in Southern California, that could save you 2 or 3 hours just travel. So
Absolutely.
that's a big issue. So your company's a lot about metrics and how you're measuring your performance. Could you kind of elaborate on that a little bit?
Yes, absolutely. So besides doing everything virtually from the very beginning, we also said we wanted metrics. We wanted to be able to measure the quality of our care and measure the improvement of our clients. And so we use something called the M3 assessment. It allows you to do a quantitative assessment of multiple mental health conditions. So anxiety, depression, bipolar disorder, PTSD, substance use, suicidal ideation. And it's about 5 minutes, 27 questions. You do it online in a browser, but it gives you a quantitative measurement of your risk of diagnosis. So it says you're at an 85% level for depression. You're at a 65% level for PTSD. And we do that before your very first session. So your counselor has that information, they validate it, they review it with you. So you see an actual written report, here's what's going on with me. It's kind of like, you go to the doctor and they give you a blood test. And so then you develop the treatment plan and you know what to kind of expect. Then we reassess you as you go through. So typically every 6 sessions or so, you redo the M3 and you can actually track your improvement. And we go over that and the counselor goes over it with you. And then we can also look globally and see and say, okay, we've had 1,000 clients. Here was their condition when they came in. Here was their condition after we treated them. And we're able to actually show the effectiveness of our care. So, you kind of say, well, are the EHome counselors any good? Does virtual care work? Does metrics-based care make a difference? And we're actually able to show that. And what we show is that, across all those different conditions, 70, 80+% of people improve, and many of them by 50 to 75% or more, and actually go into remission. So people think, oh, if I start counseling, I'm going to be in it forever. And how do I know when I'm done? And well, through the metrics, we can actually show you that. And in some cases, as few as 6 sessions, we can have a dramatic improvement, even with people who have severe conditions. So, but it's very personalized, and no one else out there today is doing that level of assessment and validation of what they're doing. So we're, as I said, we reinventing the business, reinventing the industry, and doing it very differently.
Yeah, excellent. So what have you seen over the past year? Have some things emerged from the longer term psychological impacts of the COVID pandemic?
Oh, absolutely. Kind of interesting. Prior to the pandemic, about 20% of adult Americans had a mental health condition. Post-pandemic, and these are numbers from the CDC, 40% do. It's doubled.
Wow.
So 2 in 5 adult Americans have a mental health condition. We've seen increases, again, using our metrics and our database, we can actually analyze all this. We've seen a 33% increase in depression, which was already very high at almost 60%. Anxiety, 27%. We've seen PTSD up 88%. And a lot of people think, well, PTSD is primarily veterans or first responders. No, it's in the general population. The CDC reported that in the age group of 18 to 30-year-olds, 32%, almost a third, have PTSD now. And if you think about it, COVID was a traumatic event for people. And so it's no wonder that we're seeing this. Drug overdose deaths are up almost 30% and again nationally, and we have pockets where it's up, far more than that. But over 93,000 people died in 2020 from drug overdose deaths, and that was prior to that we had in the order of kind of 60, 70,000, and now we're 93,000, and that's actually a low estimate. They think it's going to go up to over 100,000. So this is really impacting us. With COVID, the first thing you heard about was the physical illness and the deaths, and that's been tracked very closely. You have the financial impact, and it seems like fortunately we're kind of getting over some of that part. But the third element is that psychological impact, and that's what we're seeing now. And that's frankly going to be a lot more long-term than even the physical and the financial.
I would agree. I think it is a significant challenge. You talked about how EHome can help match people with a counselor. Could you elaborate a little bit more on that?
Absolutely. So a lot of people, when they are thinking about getting care, they have a couple of things. The first is, well, do I have a mental health condition? And if I do, how severe is it? And so that's what we help with the M3, to actually show you what conditions you have and how severe they are. But then their next question is, okay, if I do, how do I find a good counselor? And for many people, that's a huge issue. I mean, do you ask around? Do you Google search? What do you do? So we take that all out of the equation. We have a fabulous client care team who speaks individually with every single person, every client, to find out what they're looking for in their counseling, to help them through the process, help them with their insurance, their intake paperwork, all that sort of thing. And then they actually match you up with a counselor that meets your needs and schedule the appointments, everything else. So you don't have to worry about it. And this team is so good, we actually tracked their success in placing people with counselors, and it was 95%.
Wow.
But even if we don't place you with a counselor you like, it's as simple as just getting a different video link. You don't have to drive across town to meet with a different counselor. So again, all the benefits of virtual care. But part of that too, Randy, is that, and I learned this at Disney actually, you're only as good as the people that you hire. And so we have a very rigorous process for selecting our counselors, where we select only the A-level counselors. There's a huge difference, just like in any profession, between the A, B, C, and D level folks. We want the A players because we know they're going to get the best outcomes in the shortest period of time. And so we're very proud of our counselors. They are outstanding, and we get consistent feedback from our clients that they've just been amazed at how improved they are under our care.
Yeah, awesome. Great. It's a great program. So you've talked about the stats and the metrics, but can you share a couple of stories about folks that you've helped? Because I think that'll kind of bring it home to people that are listening today.
Sure. Well, one of my favorite stories was about one of the warriors that we treated, and he was having a session with his counselor, and he said, "Can you excuse me for a minute?" And the counselor said, "Yes, of course." So he left the room. He comes back in, and he brings his two young sons, and he sits his sons on his lap, and he says, "Boys, I'd like you to meet Mr. Brannon. I know I have not been the kind of dad I should have been for you, but Mr. Brannon is making me into the kind of dad I want to be for you."
Wow.
And when you think about that, the generational impact of people getting treatment for mental health conditions. So, this warrior had PTSD and other conditions that was severely limiting him in his being a father. And the fact that he reached out, he got care, and his sons are going to benefit from that is huge. Yeah. So I just really encourage people, if you're struggling in any way with depression, anxiety, PTSD, addiction, get help, because you're helping yourself, you're helping your family, you're helping future generations, and we can help you.
Yes.
So, we have proven effectiveness that we can take care of you and get you better and get your life restored, which makes a huge difference for your loved ones as well.
Yeah. Absolutely critical, especially when you have children from birth to 7, because that's when imprinting is so important. And we know that kind of actually lays a foundation for what they're to become. And so I think it's critical that people, if they're experiencing behavioral issues, to reach out and get help.
The other thing I would say, Randy, you mentioned children. If you have teenagers, I really encourage you to understand about their mental health. 25% of mental illness is evidenced before age 14, 75% before age 25. And so a lot of parents of teenagers say, they're just a moody teenager. Oh, all teenagers act this way. Oh, I don't need to worry about this. When in fact, they should be making sure their kids are assessed by their pediatricians. There's online assessments you can do, the parent can do, and then the child can actually do. But if you take care of it early, then you have a huge lifetime benefit for your kids. And it's something that, we all take our kids to the pediatrician for physical illness, but we don't think about the mental side, which can be just or even more important.
Yeah, it's an excellent point. Cost is often sometimes a barrier for some people. So how are you helping to address that?
Well, most people don't realize that their insurance actually covers mental health care. And this is something by federal law, Mental Health Parity Act requires that the insurance companies cover mental health care. So many people say, oh, I'm going to have to pay for this out of pocket. That's the way it used to be, but it's not anymore. So, our company accepts all the major insurance carriers, whether it's, Aetna, Humana, Cigna, Optum. And typically, there's a minimal copay for that. In some cases, the companies even completely waive copays and deductibles because the companies are now understanding if they take care of it sooner, they're going to have a lot lower costs in the future. So, and then we have for EHome, for example, affordable self-pay options too. But really, don't neglect your mental health, because it's going to prevent you to doing so many things in life, and we can get you the care you need and get it where you can do it cost effectively.
So there are many, I think and that's excellent points. I know in many fire and emergency services, police departments, they have contracted with local providers. Is that something that if they wanted to contract with EHome, that you would be open to doing a contract with an individual department so that their members could access your services?
Oh, absolutely. And we do that today. We do that with self-insured employers, municipalities, fire departments. I mean, yes. And here's something people may not realize. When you get the virtual care, it's a fraction of the cost of, for example, residential care. So, residential PTSD programs can cost $30,000, $50,000, $70,000 for 2 to 3 weeks of care that's being paid by that fire department. And our program is less than $5,000 and just as effective. So yes, I really encourage them to reach out to us and talk to us, because the other thing is just getting people the care they need, right? Where they don't have to travel, where they may be in a rural area where there just aren't physically counselors. I mean, more than a third of the counties in the United States have no or very, very limited mental health services. A third. And so how do people there get counseling help if they don't get it virtually?
Yeah, well, and I think that plays right into a majority of the fire service because 72%, I think, about 70% of the fire service is volunteer. And many of those
Yep.
are in locations that probably don't have access to mental health care providers. So this is another great opportunity for them to support their members' mental health. So, I would encourage them to look at you to do so. We've talked a little bit about veterans, and I know you've got a special place in your heart for them because you are one. But can you can you just elaborate a little bit more on what you're doing with Wounded Warriors and how that program has rolled out?
Sure, absolutely. So we've been a partner with Wounded Warrior for, I guess, a couple of years now, 2019, and they are at the cutting edge of care for, particularly for PTSD. Basically, the Veterans Administration and Wounded Warriors are the absolute best for PTSD treatment. We signed on with them to provide both general counseling services and PTSD and addiction care. And in that time, we've, as I said, treated thousands of veterans. They typically, again, they come into our program. And by the way, if you're a post 9/11 veteran, you can get free care from Wounded Warrior Project if you just reach out to them. And it's an unbelievable program, free, high quality care. But they refer warriors to us. We screen them just like we do everybody else. We do the assessments, and then we determine what program they go into. And we have a general counseling, intensive counseling, PTSD, addiction programs, and we take care of them from there. But yeah, it's fantastic. We've actually, just this week, we've been working on a report for Wounded Warrior to show the impact of COVID on veteran mental health, and it has been very significant. Just like the general population, but then also for the warriors who have gone through our program, show them the effectiveness of our treatment, and so which has been pretty significant. So yeah, I can't speak highly enough about Wounded Warrior. Amazing people there, and please, if you're a veteran, reach out and take advantage of their incredible services.
Well, I think that translates into the impact that COVID's had on our first responders as well. There was a mechanism by which we could do exactly what Wounded Warriors is doing to measure the impact, on our firefighters and police officers, because they went through hell this last year and a half, and they're still going through it.
Well, and even again, prior to COVID, 20% of firefighters evidence PTSD.
Yeah.
And so you can expect with COVID that number has gone up dramatically. But yes, we've seen firefighters, police officers, healthcare professionals. That industry has been hit incredibly hard, and the choices that they've had to make, the things they've had to see, having to be with loved ones when their families can't be with them, and I mean it's been terrible for people. So and it takes a toll. That's the whole thing. It builds up over time. So you've got to just get the care and get the treatment. And it's interesting, our program for first responders for PTSD is slightly different from veterans. And the difference is that with veterans, they've experienced the traumatic event and will likely not experience future traumatic events. With first responders, they are likely to have future traumatic events. So we actually train them in how they can manage that in the future and help themselves after they experience those events. So it's a slightly different program, but tailored to the specific needs of the different populations.
Yeah, that's an excellent point, because the significant emotional events that we have that often lead to some mental health issues are ongoing for the first responder throughout their career. So I think that's an excellent observation and strategy, is to say, okay, let's deal with what you already have in your bucket, but let's make sure that we design a bucket that lets it go away, because you're going to have more.
That's exactly right. Yep.
Yeah. So when we talked offline, we talked a little bit about some apps that you could use to evaluate where you're at mental health wise. Could you kind of explain a little bit about that?
Sure, absolutely. So we partnered with a company called Mooditude, and they have a fabulous app that you can download off the Apple or Android store, and completely free to download it. In that app, you can actually do the same assessment that we do, the M3 assessment, and find out if you've got a mental health condition. And it'll actually give you the results in each of the different categories: depression, anxiety, PTSD, so forth. And then if you hit certain trigger points, it will suggest that you would benefit from getting professional counseling. And then and this is completely your choice, but you can choose to then have your information sent to us, your contact information, for our client care team to reach out to you and schedule you to meet with a counselor. So, it resolves those two issues. Do I have a mental health condition? And if I do have a mental health condition, how do I find a great counselor? We've done all that basically through the app. And it also has great exercises you can do, cognitive behavioral therapy exercises, meditation, journaling, all kinds of things that will just help your general mental health. But specifically, if you have a specific need, that's available. And then we also have in our programs proprietary apps for addiction and shortly for PTSD that have, for example, daily videos, inspirational, educational videos, exercises, things you can do. We took the VA PTSD handbook, which is considered the best resource in the world on PTSD, took their exercises and actually translated them from paper into the app. So it was very convenient to use. And so we're really excited about that. To our knowledge, it's the only app that has that comprehensive program for PTSD. But we don't believe an app can ever replace a human counselor, but we do believe that it can support you in between your counseling sessions.
So, final words for today. You want to share with our audience, our police and firefighters that are watching, but anybody. I mean, we have many different professions that listen in, and what would you say to them?
So I would tell them, Randy, that do not neglect your mental health. And if you think you may have a problem, get treatment, do the assessment, get in with professional counseling, because mental health is just like physical health, or mental illness is similar to physical illness. The sooner you identify and take care of it, the more likely you're going to have a great outcome in a shorter period of time. If you have stage 1 cancer, it's a whole lot easier to treat than stage 4. Yeah. And if you have mild to moderate depression, that's a lot easier to treat than addiction, which can come from neglected depression or PTSD. So really, reach out, get that help you need. You can do it completely confidentially, completely conveniently, paid for by your insurance, and don't wait. Get it now, get it taken care of, because you're going to be a lot better off, as will be your family and all the other people around you. It will make a huge change. And we've just seen so many clients who come and say, I wish I'd done this sooner, because it's just changed my life. Yeah. And so please come get help. You can go to our website, ehomegroup.com. If you Google eHome Counseling Group, and that'll just take you through the whole thing. You can contact us there. Our phone number's on there, but get the help you need now. Yeah.
Well, appreciate what you're doing. I know in our discussions prior to today, I know your heart's. I know this is a business, but I know your heart is in the right place in respect to not only wanting to help our veterans, but also just helping the general population, our firefighters, our police officers, find that path to better mental health so that they can have a life well lived. And appreciate your effort. And thank you so much for being with me today.
Well, I appreciate you, Randy, and what you're doing, and also what all of our first responders are doing, and particularly during these challenging times. I'm just so thankful for each and every one of you. Thank you.
Thank you.